Hi, I'm Doug Olenek, online editor with SC Media, and I'm here today with Chester Wisniewski, Principal Research Scientist with Sophos. How are you today, Chester?
I'm well, thanks for having me.
Great, thanks. We're here today to talk about the Sophos 2018 malware report. And could you give us a little bit of insight on what you guys saw?
Sure. I mean, looking at what we've been seeing leading up to the time where we wrote the report, sadly, ransomware, really 2017 was dominated by ransomware of all sorts, and, things making headlines like WannaCry, of course, because of it being a worm and it spreading around. But we also saw ransomware for Mac, we saw ransomware for Linux, we saw ransomware for Android, sort of the criminals not really leaving any stone unturned.
Now, you'd mentioned a little bit about, in the report, I believe, about the healthcare side of it. Is healthcare actually being targeted, or are they just sort of being caught up in the sweep of ransomware that's out there?
Yeah, I don't really think it's being targeted as an industry per se. I think sadly the healthcare industry really struggles with a lot of the basics of security. It's just incredibly difficult in a hospital environment to patch all those MRI machines and IVs and all these different stuff. And we heard a lot of things about hacked medical devices this year. And it's the same cause, right? If you've got a lot of vulnerable systems, then they're going to end up getting infected with malware a lot more often. And it's very difficult for health institutions to keep everything operating at full efficiency to protect patients at the same time that they're trying to get their IT jobs done.
Now, I understand that in the healthcare industry and in other industries as well, part of the problem isn't so much the bits and bytes of the exploit that's going on, but the human side of it a little bit. Can you tell me what sort of changes you see needed to be put in place for that to cure itself, so to speak?
Yeah, I think this is an IT security thing as a big picture problem that, of course, is amplified in some environments, like you mentioned, healthcare. But the social side of this is really important, right? Most security people come from a very technical background, and they don't necessarily understand how to communicate risk effectively to upper management to get the support they need, sometimes the budget or even the disruption to the business that needs to be done in order to do something to secure information. But we also have the problem going down where people don't necessarily trust the security staff or feel that they might be told no, so they don't share information with us, right? They're worried that we're going to take away the iPad or this, that, or their access to some information, and so they don't tell us what they're doing, and in turn that introduces a lot of risk that I think has resulted in some of these big data breaches we heard about this year.
And I would imagine in healthcare and in hospitals, the need for patient security and safety in the minds of the staff might sometimes override the cybersecurity concerns.
Always, yeah. I mean, if you talk to doctors and nurses, and you see all these pictures of the password posted on the sticky note on the machine in the ER or in the surgery or this kind of thing, and we as security people, get all angry about it, right? It's like, no, like, are you really going to not let that nurse issue that medicine to that patient when it could save their life because of a password, because somebody's not there at that moment, that type of thing. And we see this all over hospitals, not just with computer security. We see it with physical security as well, for access to rooms with badges, sharing of badges, or these types of things happening as well. We have to design security systems to be compatible with the environment that they're in, and if we don't, people will bypass them every time. And when you see that sticky note, that's not a failure of the doctors and nurses, that's a failure of the security team, because they built a system that didn't work in the environment.
And is training the answer to that problem?
I think it certainly can help. I think we really need to bring together the regular staff and the security staff together a lot more often and go, here's what we're trying to do. How do we get there in a way that works for you and accomplishes the goal of data security that we all desire for our organizations?
Great. Well, Chester, thank you so much for being here. Again, I'm Doug Olenek, the online editor with SC Media.